welcome to my channel. In this video, I will be sharing 10 essential items that I believe every nurse as well as nursing student need before they start a shift. It's pens. You need more than 2. I know some people watching this used to work with me and they know I was always the pen thief. If I was around and their pen was missing, they would come find me and sure enough, I would have their pen. This one should be a given, but I have witnessed a few nurses charting heart sounds with no stethoscope. Bandage scissors. These will come in handy every time. If you need to cut off bandages, if you need to open a Foley catheter package, if you need to open a heart IV bag, here are your scissors. Is a pen light. You need a pen light in order to perform your neurological check. You need to do a neurological check on every patient, even your walkie-talkie. Item that I think is essential for every nurse is alcohol pads. You need these in your pocket at all times. You have to think about it, as nurses, we give a lot of IV medication, so we have to rub that port before we inject that needle, clean our pens off. If it drops on the floor or in the patient bed, we have an alcohol pad, we can just clean it off. Between patients, you also can clean off your septic. At the start of the shift, I always had a pocket of these, and they are saline flushes. How many times have I went in a room to give a medication and the IV line was no longer patent? So I started carrying these. When I went into a patient room to do my assessment, I also flushed my IVs, because then I knew before I gave a medication that IV site was still accessible. So it saved me time, because if I have to give a blood pressure med or pain medication, my patient gonna be mad at me because now I have to restart an IV or call the IV team if the patient is a different start. I always carry this, and that is tape. I have been in rooms and the patient will move their arm the wrong way and retape the IV down without losing the site. This item is essential because I don't do well with smell. So I think every nurse and nursing student should carry peppermint oil, because if you go in a room and the patient, you know the smells that I'm referring to, again, I don't want to offend anybody, you can put the oil here and it will block out all the horrible smell, and you would thank me for that suggestion. Your brains. Oh my God. That report sheet, I had everything on the report sheet. I mean, the times I gave medication, vital signs, if they had a bowel movement. I lost this in the course of a shift. I stopped everything I was doing to go find it because I wouldn't be organized. My brain kept me organized. Item is healthy meals. We all know as nurses, sometimes we don't get a lunch break. So if we don't end up bringing healthy meals or snacks, we end up going to the vending machine, and we all know there's no healthy options in a vending machine.